Last winter, there was a bad ice storm right around New Year's. A mom went to a small rural hospital in North Carolina in preterm labor. She was only 23 weeks along. The storm was so bad, they couldn't move her for a day. I met her as they transferred her from the stretcher onto the hospital bed. Her baby was born just 20 minutes later, weighing less than a pound. That weekend, he struggled for life in the neonatal intensive care unit. And on Monday, Mom was back at work, 100 miles away. She couldn't afford to take time off to be with her critically ill newborn. Unfortunately, her story isn't an uncommon one. In the United States, 1 of 5 employed women is back at work within 10 days postpartum. If you've been a mom or a dad, if you know a mom or a dad, think about that. At 10 days postpartum, 1 in 5 employed women is back at work. And that's not an accident. It's because we're the only high-income country in the world without any provision for paid parental leave. The US is here in orange. Those countries in green, most of the ones with which we like to compare ourselves, have paid leave for mothers and fathers. Those in beige have it for moms. In the US, we simply don't value caregiving. We don't care about parenting. Now, it's absolutely essential that we have universal, paid, job-protected leave to ensure that every one of us can meet the acute needs of our loved ones, while at the same time earning our livelihood. But I'd argue we need more than paid leave. And that's because the American workplace has been transformed in the last half-century. Consider medicine. In the 1960s, less than 8% of medical school graduates were women. In 2016, women comprised half of the entering class of medical students in this country. We've come an extraordinarily long way. And in doing so, we've also transformed the American family. Especially for middle-class women, the feminist movement has meant the opportunity to realize professional passions, to seek all sorts of different careers. It also means that today, in 4 out of 10 households with children under 18, women are the primary or sole breadwinner. At its best, this paid employment brings self-realization and enormous career potential. Today, women can be anything. We can even be fighter pilots. However, when we celebrate these achievements of women, it's important to realize that for some women, paid leave isn't about self-realization or empowerment. That mom I took care of, she wasn't back at work on Monday because she was passionate about her job. She was back at work because she didn't have a choice. And there are countless women who are working who would love to be able to be home with their kids, but simply can't afford to do so. And the fundamental problem is, regardless of why parents are in the workforce in large numbers, we live in a world that's engineered for this family, right? A full-time working dad backed up at home by a stay-at-home mom. So that's why, for example, elementary schools still seem to believe that all mothers are home in the middle of the day on a weekday, available on short notice for school events. That's why my kids' kindergarten mother's tea was held at a highly convenient 1 p.m. on a Thursday. An amazing number of moms managed to make it, but 1 p.m. on a Thursday is not a really optimal time. In contrast, the Dads and Donuts event for Father's Day was held at 7:30 a.m. on Friday because, you know, men have jobs and they need to get to work and we must accommodate them. Now, I think that this fundamental disconnect is almost like trying to stream high-definition video over a 14.4 modem. It just doesn't work. But we're all trying to live with it every day. And sometimes it's annoying. The Mother's Day tea incident was irritating. But other times, it has a profound effect on our quality of life. Now, I want to be clear. All parents work, whether they work in the paid workforce or they work caring for their kids at home. But the reality is that we only count that paid work. So consider a mom who has her first baby, stays home to care for that child. She leaves the paid workforce. Her paycheck goes away. Gross domestic product shrinks. If that same mom returns to the paid workforce, the GDP goes up, even as the care work she can perform goes down. We track the GDP, determines the stock market, it elects or doesn't elect presidents. But that care work, that waxing and waning of what we can do to care for our families, that doesn't count. We count paid work. We don't count care work. And yet, that uncounted care work, that's what runs PTAs, churches, mosques, and synagogues. That unpaid care work is what coaches YMCA basketball and soccer. That unpaid care work is who stops by when a neighbor's been hospitalized and helps out in the hospital. It's what drops a casserole off at a family with a new baby. That unpaid care work is what tends to a dying parent with metastatic cancer. But that care work doesn't count in our economy. It also doesn't count at retirement. If an adult stays home for 2 decades to raise the kids and later goes to get their Social Security payments, they didn't work for 20 years, and their payments are docked accordingly. We simply don't value care work in our society. And that has significant consequences. Whereas once upon a time, one salary was enough to support a full-time parent, another parent at home, and a family, at that time we had a care work surplus. There was somebody at home to sort of take care of these things. Today, we have a care work deficit. We see that deficit in the lack of access to childcare. Here in North Carolina, it's cheaper to pay for a year at NC State than it is to pay for daycare. Here in North Carolina, there are 19,000 families on the waiting list for subsidized childcare. That care deficit affects all of our quality of life. That's why American parents are more unhappy compared with non-parents than parents in 22 European and English-speaking countries. Why the gap? Researchers found a simple explanation. Here, we lack policies that make it less stressful and less costly to combine paid work with child rearing. We are facing a profound care work deficit. We desperately need to reshape our economy so that each of us can contribute our unique talents while at the same time assuring the well-being of our children. Howard Thurman has said, "Don't ask what the world needs. Ask what makes you come alive and go do it. Because what the world needs is people who have come alive." We need to remake our economy so that each of us can do that thing that makes us come alive while ensuring the safety and well-being of our loved ones. I would argue that we need a concerted, targeted investment in our care work infrastructure. I'd like to propose that we need a Care for America Corps. The Care for America Corps would bring together local caregiving agencies, community colleges, and universities to provide opportunities for direct service, career development, and to elevate the value of care work. So first, direct service. The Corps would recruit a cohort of young men and women from diverse backgrounds who are passionate about careers in caregiving. They would work with local caregiving agencies as apprentices to seasoned care workers for a 2-year term. Placements would span the life course. Some Care for America Corps members would work with newborns. They'd become postpartum doulas and breastfeeding educators, supporting home visiting programs and families. Others would work in childcare, partnering with experienced providers to assist in building capacity for high-quality care. Finally, others would care for older adults, assisting with mobility, providing home hospice services at the end of life. By enrolling a diverse cohort of care workers and training them, we would expand the pool of care workers, allowing proven agencies to serve more clients and narrowing the care work deficit. Second, the Corps would provide career development. It turns out that the caring professions are the fastest growing sector of our economy. In the next 10 years, 8 of the 10 fastest growing jobs are in the care work industries. And unlike manufacturing, it's pretty hard to automate caregiving or ship it overseas. So these are jobs that are going to stay in the United States and continue to have value. The Care for America Corps would be specifically designed to put people on the first rungs of the ladder to caring professions. Care for America Corps members would have opportunities for shadowing and mentoring in the caregiving professions. Through community colleges, they could complete coursework for certification and licensure. They'd be eligible for further education funding and for job placement at the end of their time of service. With support from universities, Care for America would also become a prestigious transition to medical school. Currently, many aspiring doctors spend a few years in a lab, burnishing their pipetting skills in order to brush up their medical school resume. For some people, that's the beginning of a lifetime of career in biomedical research, and more power to them. But there are others who might actually get more out of direct care work during that time period. And imagine if our oncologists had worked as home hospice health aides before training as physicians. What if our pediatricians had managed the terrible twos, times 6 to 10 in a daycare classroom, before they started offering advice to parents? I still remember vividly how our first pediatrician, who was childless, gave us this careful lecture on how we should never, ever allow our 1-month-old to fall asleep while being held, because that would teach bad sleep habits. That is impossible. But that was his advice that he'd read somewhere in a textbook. By engaging care providers in real-life caring experiences before they go on to become health professionals, we would build a more seasoned and experienced team that would be better able to assist their patients. Finally, the Corps would elevate care work and its value. Consider the plight of child care workers. Of all the personal caregiving professions, funeral service worker, animal worker, cosmetologist, the lowest paid are child care workers. Child care workers earn an average of $9.77 an hour. In every state, child care wages for a family of 3 qualify one for public aid. There are far too many child care workers who can't afford child care for their own kids because they are paid so little as child care providers. The Care for America Corp, and despite this, we know that every dollar invested in early childhood education reaps a $7 return on investment. So we should be putting more money into early childhood care, not paying people poverty wages to do this critically important work. Right now, what we lack is the moral will to invest in caregiving. And I would argue that by engaging a critical mass of young adults in caregiving early in their careers, we would elevate the value of care work. Future doctors, future teachers, future administrators, future legislators would have first-hand understanding of the value of care work, and that would impact policymaking going forward. In addition, the Care for America Corps would lift up experienced care workers as mentors, acknowledging them as experts in the practice of care work, and paying them a salary commensurate with their experience as they mentor young people going into the caring professions. So let's do this. Let's find a way to pilot the Care for America model, say in 5 to 10 communities. Let's find a community college, a university, and some caregiving agencies who want to move this forward. Let's build a system that allows each of us to do what it is that makes us come alive, while at the same time ensuring the safety and well-being of our children. Let's build a Care for America Corps. Thank you.